A new report by the California Healthcare Consumer Advocacy Coalition is giving us a clearer picture of how the decisions made in Washington impact us here in the Golden State, specifically as it relates to healthcare. And this morning, we welcome Rachel Lynn Gish. She is the Director of Communications for Health Access California. Rachel, good morning. Thanks for being here.
Good morning. Thank you for having me.
Give us a couple of the highlights from this report.
Yes, so we're talking about right now a lot of folks that get their health care coverage through our state-based exchange, Covered California. There are over 2 million Californians that receive their care through this exchange, and almost all of them receive some sort of federal subsidy to help pay their premiums. Now, here in Sacramento County, we're talking about over 50,000 Californians that are receiving these subsidies to help pay their premiums and make sure them and their families get and stay covered.
What ultimately needs to happen so that those subsidies do continue?
Yes. So when we passed the Affordable Care Act many years ago, that had a certain level of premium assistance. But then with the subsequent action in Washington, D.C., like the Inflation Reduction Act, there's even more financial help coming. And we're talking if these subsidies are set to expire in 2025. And if Congress doesn't act to extend those subsidies, many in Sacramento County could see their premiums increase by over $1,000 a year. And sometimes even more. And
what do you think is going to be the long-term impact? I mean, do you think that it just is going to mean more people are going to have to go without health care coverage?
Yeah, a number of studies that have come out over just the last couple of weeks, including with Covered California itself, estimate that there are tens of thousands of Californians that will go uninsured if these costs increase, and that does not include the folks that will just have to figure out new ways, maybe cut back on their grocery bills or childcare bills in order to pay for health care, and going back to a time where it was really difficult for Californians and their families to afford care. And this is a lot of middle income folks too. Most people that make $60,000 or less for an individual and $124,000 a year or less as a family of four will be impacted.
Yeah, this is very frightening to even think about it. We have just a few seconds left here, but ultimately, is there anything that people can be doing right now?
Yes, we encourage you to reach out to your Congress member. They're having conversations right now, hearings, writing letters, and let them know that you support these extended subsidies and not having spikes in your health care coverage.
All right, Rachel, thank you so much for joining us this morning. We appreciate it.
Thank you.